Sometimes when the nerve is injured here, you can do this, or you can do it slightly on one side, yeah? If I was to guess, this is a button used from the orthopedic system. It doesn't matter which system it is, but they're very
So
similar.
this is day two after my bicep was reattached. So as I said before, the distal tendon in my bicep ruptured. So this was done at work while I was trying to open a ratchet strap of all things. But yeah, it's gone. It was detached, but now it's now reattached. And following surgery, so it's a bit swollen on the site of surgery. And another thing that the surgeon said might happen is they might stretch a nerve. So my hand might not be able to do that for the first wee while. So that's what's happened to me. So I can't really straighten these fingers at the moment, but hopefully with the aid of peptides, so BPC 157 and TB 500, it's going to help me recover my nerves quicker than they normally would recover naturally. So like I need to do that to straighten my fingers. So what the doctor said to do is every so often or as much as I can, just straighten my fingers all throughout the day, just to make sure that the nerve knows to wake up, if that makes sense. So what I'm now going to do is I'm going to administer these peptides, and then I'll take you along on my journey with me to see how recovery goes. So I'm going to start off by taking a cleansing swab, so just an alcohol swab, just to make everything as clean as possible. And I'll give you my dosages of the peptides as well, what I'm doing. So when this happened, when I pulled the ratchet strap, I just felt like an electric shock go up my arm, and immediately I knew, oh, something is wrong here. Like this doesn't feel right. And then I posted on Instagram to say, oh, because I could still move my arm like full extension and everything else. And I posted on Instagram to ask the question of anybody who's had a bicep injury before to see if they could do what I was doing. So continue to move my arm and continue to pick up stuff like as if nothing had happened. Everybody said no. If your bicep is completely off, you won't be able to lift anything, or you'll be in a lot of pain. But I wasn't in a lot of pain when I tore my bicep. And then I went to A&E the following day, and they said, "Oh no, your bicep is fine. Like we can still feel a tendon there." But I was kind of sure that my bicep had gone because of the feeling that I'd had. It was like a sudden electric shock, like I said. So what I done is I went and had an MRI done, and there behold, the MRI did show that my distal bicep was ruptured completely. So it didn't retract all the way, but it retracted. I think it was 3 centimeters, but it was still detached. So I don't know how I was able to keep functioning and moving, but here we go. So give the wee peptides a wee swab, and then what I've been using is about 400 milliliters or millimeters. I'll double check. So wipe the area as well. Make sure try to be as clean as possible. And then I put both peptides into one of these syringes. So this goes up in point 0.1, point 0.2, point 0.3, point 0.4, point 0.5, point 0.6, point 0.7, point 0.8, point 0.9, and 1. So this is a 1 millimeter gauge. So what I've been using to administer the peptides is zero point 0.4 of each. So this is the TB 500. Yeah, make sure you've got the 400 or the 0 0.4. And then do the same again. So I just use the same syringe to put both in. And I've done this before with previous injuries with the peptides. I tend to do this in the morning and at night as well. So that's the protocol that I've been following. There we go. Okay, and then find the spot where you're gonna inject it. Because there's still a bit of swelling for me at the moment from the bicep rupture. So it goes in, and then aspirate a bit, make sure you've not hit a nerve, blood vessel or anything. Yeah, okay, so that's all fine. And then just administer the dosage. Hopefully it should help. But I must add, on the first day, like my whole hand was completely numb. But now there's a lot of sensation, so I can feel everything again. So the nerves are waking up and kind of still there. But the doctor did assure me that he didn't cut through a nerve because he didn't see any nerves. But then he might have stretched them. So that's why I've got this problem where I can't use the nerves to lift my fingers up at the moment. But hopefully, like I said, that will rectify. So yeah, so that's day 2, and we'll see how day 3 goes. This is now day 4 of the rupture, and I've decided to go to the gym just to keep active. So I'm going to do some leg exercises today. So hopefully do some leg press, some leg curls, leg extensions, and just keep active so my muscles don't atrophy too much over the next couple of months. But I'll focus mainly on lower body for the meantime, for obvious reasons, and then see how we get on from there. This is day 6 of my distal tendon bicep injury, and the time is actually 5 o'clock in the morning because I'm just going to catch a flight to go to London to go and see a specialist at the Harley Street Specialist Hospital. So the guy's name is Mr. Ali Nuzani. So Mr. Ali Nuzani is supposed to be world-renowned with anything to do with your joints in your elbow or shoulder or your hand, and to do with the nerves in that hand. And my surgeon did say there was nothing to worry about, everything was going to be fine, but just to be extra cautious and extra safe, because I want to go back into the sport of strongman, or I want to go back to work fully without having any problems, and we're going to go see Mr. Nuzani in London. So I'm going to go catch a flight right now, and then I'll see you when we're there. Yeah, so I've just arrived at Inverness Airport, and I need to watch my footing because it's an absolute ice rink. Like, I've almost fell a couple of times and jerked my bicep. So I'm just taking my time, making sure that I don't actually fall. So I'm just going to head on into the airport, and I'm already checked in, so that shouldn't be a problem. But yeah, I'm in here plenty of time. So I'll catch the flight, and then we'll see you in London. I've just arrived in London, Gatwick, and I've just picked up my rent-a-car, and I'm going to drive across to see one of my good pals down, I think it's like a 30-minute drive, because my appointment is actually tomorrow. So I'll do some sightseeing and see what the crack is. And I've got quite a decent car, to be fair. It's an Audi Q3. So I'll give you a wee look. Yeah, so tomorrow have the appointment, and then see what the crack is, and then see where we go from there. Yeah, so I'm just currently on Harley Street right now. I'm just looking for the entrance to the consultant's office, but hopefully it's good news. Hopefully they can do something about it. I'm sure that's going to be the case. Because this guy's supposed to know what he's doing.
That's it. Let me have a look at it. Let's take it to the nerve, right? Which supplies the muscles that do this and this, yeah? Sometimes when the nerve is injured here, you can do this, but you can do it slightly on one side, yeah? Right? Because that nerve supplies comes higher up.
Okay.
Right? So if you can do this, where it goes on one side, it suggests that now more than likely, the nerve isn't damaged. It's just bruised a little bit and gone to sleep. Okay, so that's what happens. The nerve is very close, so sometimes it does that. He said you got a good biceps fixation.
That's what he said.
Yeah, gotcha.
He said the surgery was very successful. That's what he said to me. But
Can you straighten them more? It's tighter.
just wasn't clear.
Bicep looks good. Yeah. Can you turn it around? Can you twist it?
There's a pain.
Where do you feel it?
Yeah.
Gotcha. Okay. The dressings are. When was the last time it changed? Has it been changed?
Yeah, it was changed 2 or 3 days ago.
So we'll have a look at it today, make sure it's okay as well.
Okay.
Okay, now, what I want you to do is down here, I want you to move your arm up. So that nerve comes from higher up, and that's fine, yeah? As does a triceps. Push your triceps away.
So push it towards you.
Triceps, yeah, perfect. Solid triceps, yeah? Now we're looking at where the nerve is involved, right? So lift your wrist up, and you can see it goes up on more on one side, yeah? So you are, when you're lifting up, you're going a little bit. So you can do it center. Can you do it this way?
No,
Right, no, so it's that muscle, ECRL, comes from higher up, yeah? So that's fine. Can you do your fingers?
No, and that's the thing I'm kind of here about. And my thumb is so I can't really I can't do thumbs up.
Yeah. And gotcha. Okay. So this is the button that we'll use. Now, if I was to guess, this is a button used from the orthopedics system. It doesn't matter which system it is, but they're very similar. But given your size and so on, and given the button size, this is likely to be orthopedics biceps kick. But it doesn't matter. It's a button thing that was fixed. The position, is in the right place. This is the tuberosity where the biceps sits, so it's not really an issue. The biceps appears to be fine as well, but there are, as we said, nerves around it, right? So what's actually happened, right? So I brought this up for you, right? So what happens is there's a nerve called the radial nerve, right? And when it comes across here, it kind of splits up into the superficial radial nerve, and it comes into this called the posterior trochlear nerve, and passes very close by to where the surgery is, right? Okay. Now, often what is described is not somebody drilling into the nerve or damaging the nerve or anything like that. Often what's described is when they retract, put the retractors in, they kind of push against the soft tissue and they catch the nerve, right? And it kind of gets squeezed a little bit.
Yeah. Okay.
And this nerve, unlike the nerve down here, the funny nerve, right? A kind of nerve is deep. And the deep nerves are kind of not used to people touching them and feeling them. So if you look at them funny, they go to sleep. Okay. So that's what has happened, right? So and I had a chat with Professor Roger Van Reed, who's also an elbow surgeon, and said, look, this is my view, what does he think? And we both agree the following course of actions. Yeah? We should get an ultrasound scan in to make sure the biceps is fine. We should get an ultrasound scan in to see whether the posterior trochlear nerve is. Sometimes you don't see it, but sometimes you clearly see it that it's fine and intact and not caught up in anything. Okay. And we can do that today, hopefully, yeah. I've spoken to the radiologist about your data, right? But if it's all good at this stage, we should just wait. Okay? Because we know that the likely scenario is the nerve is being squeezed, and then you wait, and then we get some nerve tests and so on a little bit later. And usually the nerve tests are 4 to 6 weeks down the line, okay? But it may just come back. If it doesn't come back, then you can explore the nerve and so on, but if it doesn't come back, and often we don't know if it fully recovers long term or not. But then you require lots of different operations to do tendon transfers and so on, and you don't want to go into that. Right? We're hoping for the best. We're hoping for the best, yeah. So that's the what the plan is. You happy with that?
So because I saw on YouTube, I was just researching, and then I saw there was a procedure where they inject something while looking at ultrasound, and then they can move nerves about.
If the nerves are in scar tissue and so on, you can do a release of the nerve through injection. So that's what not what you need, right?
Yeah, okay.
You already have a nerve that has a lot of swelling and pressure around it.
Yeah.
Last thing you want is to put more pressure around it by putting fluid in it. Yeah.
Okay.
You just want to see the nerve where it is and so on. Now you need some therapy.
Yeah.
Right? When are you heading back?
So depending on what's required. So I was going to go back tonight.
Tonight should be okay, yeah?
Yeah.
But I want you to get the ultrasound scan done. And my best guy who does the ultrasound scan is already, I've already spoken to him.
Yeah.
So I'm going to get my secretary to give him the form.
Yeah.
And then my secretary will liaise exactly when he can do it.
Okay.
So the idea would be that he's already done his list here today and he's on his way home.
Yeah.
And then do somewhere else.
Yeah.
So I've said either he'll see you somewhere else.
Yeah.
Or he'll come back and do it, but he's doing me a favor.
Okay.
Because doing us a favor to make sure we can see the nerve properly, right?
Okay, yeah, I can see that.
So you may have to hang around, you have some lunch here, and he says, I can do it now, you just come in and have it done. And,
No problem. Yeah.
happy?
Yeah, happy, yeah.
Okay.